Well, Alberta's measles outbreak continues to expand, now over 600 cases at levels we've not seen since the 1980s. There are other jurisdictions in Canada and the US going through this, but certainly in Western Canada, Alberta's situation does stand out. Now, we've got most of these cases in southern Alberta. In fact, health officials have stopped using site specific alerts and instead issued a standing measles exposure advisory for anyone visiting or living in the South Zone. So, joining us to talk a bit more about the threat measles poses, the challenge we face in dealing with this, very pleased to welcome to the program here Dr. Mark Joffe, professor of medicine, infectious diseases at the University of Alberta, previously served as Alberta's chief medical officer of health. Dr. Joffe, good to have you with us here. Welcome to the program.
Thanks very much for having me.
You wrote an op-ed, I guess it was about a month ago, just over a month ago, sort of, calling attention to the situation, warning that we needed to get a handle on this. Things have worsened considerably since then. Was that kind of to be expected, right? A situation that maybe has to get worse before it gets better?
It was predictable. We know that we have a lot of susceptible individuals in the province, people who have not been immunized for measles, and therefore we knew that this would continue for a considerable period of time before ultimately it will settle down.
What's unique about this year then? I mean, we've seen outbreaks in the past, and I mentioned too that I mean Alberta's not the only jurisdiction going through this. What sort of led to this year's situation as we understand it?
I think the situation is one that has gradually come upon us. Now, nothing here is a surprise. We knew that this would happen. Exactly when, we of course couldn't predict, but we've known for some time that we were at risk for a large measles outbreak in the province. And in fact, this is the worst outbreak that we've had for sure in this century. We had an outbreak of about 123 infections in the year 2000. And then in 2013, 2014, we had two outbreaks of about 44 and 23 or thereabouts. Aside from that, we've had individual cases along the way. And then again, this year, of course, we're having a very large outbreak.
Yeah, that's the thing. I mean, eradication doesn't mean zero cases, and I think Canada officially got that status. Maybe it was the late '90s or about 25 years ago. Is that now at risk though when we see outbreaks of this size?
Very much so. We need to be careful that we use the right term. There are two terms that are often confused. There's elimination and there's eradication. So eradication means that a disease is completely gone from the world.
Okay.
So for human diseases, there's only one example where that has happened, and that was smallpox. We used to immunize for smallpox. Smallpox was eradicated. We no longer immunize for it because there is no smallpox in the world. For measles, we've used the term, and for some other diseases, we've used the term elimination. Now in Canada, what that means is that we would see occasional introductions of measles into the country. There would typically be small outbreaks, but it would be contained, and there would not be ongoing spread month after month after month. That really is the definition of elimination, that you can control an outbreak of measles within a year. So Ontario, of course, has been going through this since October 2024. We're not quite at a year, but as this goes on, we will see that our elimination status could be threatened.
Mhm. And I think, I mean, measles was once quite common, and partly there are people who went through that and maybe have the idea that it wasn't that bad, or just, the distance that's passed since that was more common. People just kind of forget about measles or don't think about measles. But why should we worry about it?
Yeah, those are really important questions. And you're right, people don't worry about measles now because it's a disease that we've forgotten about. If we go back a number of years, there was nothing we could do about measles. It was truly a rite of passage in childhood. And because they're pre-vaccine, because there was nothing really that could be done about it, again, we didn't worry about it. People didn't worry about it too much because there was nothing you could do about it. But every year pre-vaccine, or every 2 to 3 years, there would be very large outbreaks of measles in Canada. And it's important to understand measles is a fairly severe childhood illness. It's more severe than most childhood illnesses. That's the first problem. It's the most infectious of all of the diseases that we know of. So each individual with measles will typically infect 12 to 18 others if they are not immune to measles. So again, you have one or two or three cases of measles, that rapidly escalates into huge numbers, just as we're seeing now in the province. Individuals with measles, we should emphasize most people who catch measles will have a miserable illness for a week or so, and then will get better. But some don't.
Yeah.
There are
We've seen
complications
so
from
far, I think
measles.
there's been about, I think 44 hospitalizations was the last number I saw, and that's mostly children. What sort
Correct.
of complications then from measles will lead to hospitalizations?
The most common complication that would lead to a hospitalization is pneumonia. So the measles virus directly infects the lungs and can cause pneumonia, or there can be a secondary bacterial infection that follows the infection with measles a few days later. The other thing that sometimes will lead to hospitalization is diarrhea. Severe diarrhea in young infants can be very serious. And then the final thing that we worry about a lot is brain infection or encephalitis that
Yeah.
can also lead to hospitalization and serious outcomes.
Infections, I guess, there's a way to treat that, but in terms of a treatment for measles, that really doesn't exist, does it?
There is no treatment for measles. All that we can do for measles is to try to prevent it. And in fact, we can prevent it. We're very effective at preventing it with 2 doses of measles vaccine.
One of the weird things about the virus, and if you could explain this idea of the sort of amnesia of the immune system, where the immune system almost forgets other diseases it had been exposed to. What's happening there?
Yeah, thanks. That's a really important point that most people don't recognize. So, again, measles causes a fairly severe infection with illness over a week. Most people will get better, as we've just talked about. There are some complications, but what isn't often appreciated is that that infection with the measles virus leads to immune amnesia, as you just described it. It leads to an immunodeficiency state that will last for the next 2 to 3 years after an infection with measles. The measles virus targets the cells of the immune system, and we know that there can be a 20 to 70% depletion of those immune cells and antibodies, which means that after the individual completely recovers from measles, they're actually at risk to develop other kinds of infections over the next 2 to 3 years. And of course, that can lead to serious illness, hospitalizations, and occasionally deaths.
As you say, we know how to prevent this. We have a vaccine that is tried and tested and is very effective. I mean, there have been a handful, I think, of cases in vaccinated people. But talk a bit about then the safety and the efficacy of this vaccine.
So the measles vaccine has been available to us for about 60 years now. There are hundreds of millions of doses of measles containing vaccine that have been administered. We know it is highly effective. Now, we did learn back in the 90s that a single dose of measles vaccine isn't sufficient. So you need a second dose of measles vaccine. And currently in Alberta, the schedule is that infants at the age of 12 months and 18 months will receive 2 different doses of the measles vaccine. And we know that having received 2 doses of the measles vaccine is very close to 100% protective. Again, based on 60 years of experience, we also know that the vaccine is very safe. We know that there can be side effects. Parents of infants, when they come in for their vaccination, are warned about the possible side effects. But ultimately, we know that the vaccine itself is far, 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 far safer than getting infection with the measles virus.
And I guess there's a clear link here, as we've seen vaccination rates decline, and in particular in certain parts of Alberta, that's where that opening has been created for this virus.
We know that we need to maintain about 95% community immunity, sometimes called herd immunity, in order to prevent measles outbreaks. Once the immunization level or the immunity level in the population starts to drop below 95%, that's when we can start to see outbreaks occur. And over the last number of years in Alberta, our immunization rates have slid well below 95%. And that's why I mentioned earlier that we knew that at some point we were going to see a measles outbreak again in the province.
We see in the numbers too. I mean, the majority of cases are in children, unvaccinated children. So there's a pretty clear link there. So How do we address that? I mean, there's all kinds of misinformation out there around vaccinations, fear mongering. Unfortunately, I think people do just have questions, maybe just genuinely don't really know about it. How do we even start here?
Yeah, that's our challenge. So we live in an information age. There is more information available today than there's ever been at any time in history. But we're also in an era of misinformation and disinformation and a lack of trust. And that's our challenge. We know that we have a vaccine that works. It's extremely effective. We know that the vaccine is very safe. We know a lot about this vaccine because it's been used, as I mentioned, for 60 years. And yet there is information out there that is simply not accurate. And when people go looking for information, there's no guarantee that they're going to find accurate information. They may be confused at the end of it all and just not understand, what is this all about? What are these rumors or these things that I'm reading about on the internet, on social media, on my Facebook page, or wherever it may be? Um, and then complacency sets in, and people just don't go and get their children immunized as they may have done 25 or 30 years ago.
Well, maybe in a way, this can be a bit of a wake up call, or at least call attention to this challenge we face. We've seen efforts stepped up to get information to people, make vaccines more widely available. Are you seeing some positive signs, maybe that we're moving in the right direction?
Well, there's no question there's been a huge uptick in administration of measles vaccine. People are getting immunized. Whether those numbers are sufficient or not, only time will tell. But there's been a huge uptick in the number of doses of measles vaccine that have been given since this outbreak started. Of course, the challenge is we should have been able to prevent this in the first place. But, I will say the big challenge that we face is vaccines are kind of victims of their own success. Most people in Alberta wouldn't know anything about measles. We really haven't seen much measles in the last 25, 30 years. So they forget what measles is and why it's a disease that we should prevent. But I'll also say that measles is just the warning. Measles is the most infectious of all of the diseases we know of. So it's the first one that we're going to see as vaccination levels drop. But we'll start to see others. Rubella is another example. In
Yeah.
fact, it's contained in the same vaccine. Rubella itself is a very mild disease that honestly we wouldn't care about, except when pregnant women acquire rubella, they transmit it to their fetus, and the fetus is born with horrendous complications. That's why we wanted to eliminate rubella. And in fact, we've been very effective at eliminating rubella in the province, but it will come back as well because again, it's part of the same vaccine. And then, of course, other diseases that today are vaccine preventable, we're going to start to see again as our immunization rates decline.
Well, important point. We'll continue to monitor this situation. Dr. Joffe, really appreciate your insights on all of this. Thank you so much for making some time for us here.
Really appreciate it. Thanks for the opportunity.